It's okay not to be okay, pero parang it's not really okay sa ating bansa.
Mental health has long been considered a sensitive topic in the Philippines. As a country with a substantial Catholic population, depression and anxiety can sometimes be associated with a lack of faith. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. According to the World Health Organization 2023, more than 264 million people of all ages around the world have some sort of depression. While this number represents the global population, the contributing factors surrounding depression strike a similar chord. From anxiety and drug and alcohol use disorders to biological issues such as bipolar affective disorders. In the Philippines, according to the Department of Health 2020, 3.6 million Filipinos are experiencing one of the types of the mental health and neurological disorder. However, only 88 mental health cases are reported for every 100,000 Filipinos. Mental health matters. Simple sadness can lead to a worse feeling. There are many types of mental health problems and disorders. These disorders include anxiety disorders, depression, paranoia, bipolar disorder, obsessive disorder or OCD, behavioral and emotional disorders, eating disorders, and psychosis. According to a mass survey conducted by Octa Research in March 2021, 28% of Filipinos, or 3 out of every 10 Filipinos, experience emotional problems such as stress or severe sadness. Despite this, there are still many who do not seek help for their mental health. We interviewed random CMU1s to share their thoughts about the last time they felt really sad and why is it difficult to ask for help in terms of mental health issues. Here are some answers.
The last time I felt really sad, probably when one of my pet died, which is such a long time because that's your soul pet. It's something that is with you during those times when you don't understand what you feel. The company of that pet is something that comforts you, and knowing that that certain thing is gone, it really brings me so much pain and sadness.
The last time I felt really sad was last week, I guess, because of family problem.
I felt really sad, especially on times that I encountered personal and family problems. So those are the times.
I guess it is really hard to seek help in our society right now, especially that we have this motto in mind na you are okay, everyone is dealing with something. So okay ra nga dapat ikaw na lang ang modala sa imong problem, you don't want others to be bothered by your burden as well.
Siguro maybe because of what you call this pride, there might be some instances that we are too shy to ask help or to seek help from others because we have too much pride in ourselves.
For me, tungod siguro siya sa kanang stigma ba tawag ana kanang pag mo ingon ta nga nang affected iyang mental health ang ginahuna-huna dahil especially sa kanang mga karang tao kay naday sakit sa utok dili na maka-function gid properly, so mo gina siya ang reason for me.
I think nahihirapan silang humingi ng tulong because of the stigma that goes around it, and because marami pa rin ang mga tao na hindi alam kung paano i-comfort yung tao na hihingi ng tulong. So, the tendency is nahihirapan sila na humanap ng tao na pwede nilang pagkatiwalaan dun sa nararamdaman nila o sa problemang dinadala nila.
Mental health stigmas often arise from fear or misunderstanding, leading to negative perceptions of those with mental health issues. However, there is a gradual shift towards more open discussions about mental health. Today's generation is gradually becoming more open to discussing mental health. Further interviews with CMU students and teachers provided insights into the acceptance of mental health challenges.
Personally, I think it's okay to not be okay at times as long as your anger or the rage or your emotions do not get the best of you. As long as you know how to regulate them and you know how to carry yourself even in the midst of being not okay.
I guess it is really okay not to be okay because we need to remember that all our emotions are valid. And being not okay is not really mean that you are not okay. Just simply that you want to feel that way and your emotions are valid.
Especially during the time that you need to know what are your weaknesses or your strengths. So there must be time that you should say that you are not okay with that all to help develop your mental health as well.
For me, it is okay not to be okay because I believe na atong emotions is dili lang na siya sa ato ang gikan po na siya sa atong hormones and ang atong hormones dili gyud nato siya makontrol, so it's okay not to be okay.
Why is mental health important for overall health? Mental and physical health are equally important component of overall health. For example, depression increases the risk for many types of physical health problems, particularly long-lasting conditions like diabetes, heart disease, and stroke. Similarly, the presence of chronic conditions can increase risk. A continuation of the interview conducted reveals the ideas of the student about happiness and things that contributed to it.
The last time I was really happy is right now. I was eating one of my favorites and I think it's just the simple things in life that actually makes you feel fulfilled and makes your day. And it is important to keep it despite the busy days because that is what will make you happy, that eases even though there are a lot of things that's going on.
So last time I felt very happy is when we nagsa kami sa Sabangan with my friends. It was a core memory for me because aside that it is my first experience hiking with them, it is like a very nice way to connect with nature, and yeah, that's really happy for me.
Actually, every day I'm happy because every day is a blessing from God. So I can say that every day is my happy day.
Happiness is not just the absence of pain or sadness. Happiness is choosing to embrace what you are feeling and trying to overcome it by actually doing the things that would simply ease whatever it is that you're feeling. So for me, happiness is doing something that you love or having the thought na even if you're not okay, there will be better days. So I think that's happiness. It gives you hope.
I do believe that happiness is a choice. Happiness depends on you, which means that don't rely your happiness on other people. Choose happiness. That's the best that I can say. And the practice that I mostly do when to be happy is to do the things that you love. Don't mind other people. Just be yourself.
For me, happiness is loving yourself. If you love yourself, then you can say that you are totally happy. Because ourself is a blessing from God. So if we are contented, then we love ourselves, then we can feel that happiness deepens.
Mental Health Awareness Month is a great way to show support and understanding for people who are dealing with mental health issues. Raising mental health awareness can be achieved through various strategies and actions such as educate yourself and inform others, listen without judgment, volunteering in local mental health awareness programs, adopting a holistic approach to helping others, and checking your mental health condition.
Do not hesitate to reach out. Seek help, send help.